That's it.
Oh, I want to share screen. Okay. Okay, is my screen up there for you all to see?
Yes.
Okay, so again, it's the same tracker as we have. So I'm going to walk through this, and I may need Camilla's help. So if you get to this, and we'll go to sign up, and this basic information comes up. So we would type in the name.
So just to clarify, John was already signed up, so it automatically picked up his authentication.
Hey, Camilla, one thing I was noticing on the date of birth here, can we put it in so that it automatically puts the slashes between the dates? Or
it's supposed to put them automatically.
Yeah, mine didn't do it. I was born in 1577. Okay, and then the same things here. You just click in the this basic information. That's all working. COVID-19, we ask if you're not tested or tested. And I'll put in tested, and then I would put in the test date. Again, it's not putting in it doesn't put in the slashes here.
What about saying if it's positive or not? It's just asking if it's tested versus not tested, not if you're positive.
Okay, yeah. I think that does that later when it asks for the proof. But if we need it if we need to say positive or negative, do we need that? You guys can chime in.
Well, what does not tested mean? I mean, I realize what those words mean, but are we going to be doing this for people who have not been tested? Should that even be an option?
That's a good question, Virginia. I do know that what's in here is they can't get to the questionnaire unless they have tested positive. And
so who would we do this for on a non-tested? Why? I'm not sure that should be an option.
That's a good question. Yeah.
Agree.
A random person that logs into the website and wants to sign up.
Okay.
But why would they? It wouldn't work. It wouldn't work with them. It really is just for people who are positive, right?
Yeah.
So.
Check it out, Camilo.
So we would just put on here. So tested. Instead of not tested and tested, do we put positive and negative here?
No, might just not need it altogether.
Or or we just say yes, and they have to click yes. And if they don't click yes, they don't sign up.
Okay, great.
Yeah.
So they've been so we'll just have here Camilo tested positive, or no, just yes tested.
And they have to affirmatively check that, and then they get the proof request later.
Yeah, great.
So they don't have access to any of the reporting unless they upload a positive proof. This screen is a welcome screen, which only shows up to new users, and it basically just asks some new questions without obsessively asking too much from them. After this screen, it will ask you for the COVID proof. If you do not upload the COVID proof, then you will not get access into the app system and you will not be assigned an agent.
So can we leave it the way it is? And on the non-tested, if somebody checks non-tested, can an alert just go back to them that says, when you've tested positive, please come back and sign up or whatever it is, just so then they know?
Yeah, that would be great. Yes.
The other thing is, Camilo, I think we should allow them to proceed even if they don't have the COVID proof. Just make that like a follow-up item for the agents, because a lot of people don't have the COVID proof. They just got a phone call. And so we don't want to waste days where getting the COVID proof, which we could be contact tracing them.
Oh, okay.
Yes, my instructions were to make this as least friction as possible. but also requesting this information in a nice, subtle way.
Yeah, but just don't make it required. That's all. Allow them to continue.
So they can proceed without having to have proof up, but we're still asking for it. Yeah.
Yes, they can proceed already.
Yeah.
They
okay.
can.
Oh, I thought you said that if they don't upload the proof, they can't proceed.
No, they could proceed, but they just can't be assigned to an agent and waste our resources.
But I think what Jack is saying is let them proceed anyway, because they
Let
may
them
have
proceed
gotten
anyway,
a verbal yes, but they don't have proof yet.
Yeah, they will proceed. They will have a profile, and they will get access to the waiting screen, and then from there we can do other things. We can have a specific category for those people. As of right now, they can proceed. They will be after this screen. They will have access to their user profile page. So even if they don't have a COVID proof now, in the future they can always log back in and just upload it.
Right, but we want to give them the same functionality as somebody who uploaded it. And so it would just be kind of a to-do list for the agent.
Oh, okay. Right now, that's just, yeah, that's my discretion. Right now, since
Okay.
I'm the administrator, at my discretion, I approve people that, you know, that I view what they've done, and the agents, yes, of course.
Okay. Great.
So that's up to the discretion of the admins and the agents based on the rules that they want to follow.
And
Okay,
can we just go back? I'm sorry because I just want to make it clear on the not tested. Can the message just be that pops up, please sign up when positive results are received? Or what do we, I mean, I just want to close that gap on the circle on that specific question. What do we want to tell them?
I would say leave it like this, because that will be one of the things that CTS can be reminding them that they need to get that positive thing up.
No, I'm talking about the ones that haven't been tested. So they haven't been told they're positive. They haven't been tested yet.
The next page is going to ask for the proof.
But
I'm leaning towards just taking that whole COVID-19 question out about
Okay.
the testing. Can you just take it off, Camilo?
I can hide it for now, and then
Just get rid of it.
in the future
It
if we
doesn't
want to
make-
do
just take
something.
another step. And I can't imagine anybody going in
Right.
because they want to do something else. You know, I mean,
Okay, so we don't need the COVID-19 question or the date tested or the location tested.
yeah, we don't need that.
Once they upload the proof anyways, we're going to have that information.
Yeah.
Exactly.
What that information might be vital for, data down the line. Sean was talking about publication, but I don't know, we might need that.
The only concern is we want to make it really easy to sign up, and we don't want people to get hung up on, I don't remember the day I was tested. I need to go look that up. Or I don't
That's correct. Maybe we might put it somewhere else. Maybe
we don't want to do
yeah.
anything.
Move it to the user section.
I know, but if I may add, so much of our advice is given them based on the testing date, the 48 hours before, the 14 days after. That's an important date.
We can get that when the CTS calls them.
But then where would they put it?
We can you create this same
Let's move this section over to the user page.
to the agents, so the agents have to enter that.
Yeah, whenever they go into their profile page, and I'll
Right.
add it into the COVID proof category.
Yeah, so
So
they
it's
would
right
have to
next
put
to the
date
upload
tested and
button.
location of test, because that's true, Virginia. I just don't want to make it any difficult. I want them to be willing to sign up very quickly and not have any barriers.
Okay.
But
So-
it's still
I
front
have
and
a
center
thought.
in their head.
We need a date of birth. Or can the agents get that? Because I would be reluctant to put in my date of birth and my name. Because I'd say, okay, you could use that and get credit if you just find, all you need is my social security number. So you know what I'm saying?
I'd give you my name before I give you my social security number.
But date of birth is pretty,
Personal.
how about month and year or something like that?
Can we
What do we
just
need
put
to
the
know?
age,
We could
just
put
if it's not
age.
date of birth?
Just age.
Yeah.
You know what? Year and month of birth, I think is okay,
Okay.
because that way we can track them as they age or whatever. But we don't know. You don't know. We're going to be looking at this data probably for a long time. But Camilo, can you just make it like month and year of birth?
Yeah, we can do that. I mean, we
Okay.
don't have to have this in this section either. We can move the date of birth to the users page. The welcome screen should be at least
Yeah, you want to be able to
minimal as
sign up, just
possible.
putting your name, whether you're male, female, and boom, you're in.
So name, gender, and that's it.
And I have a thought about the COVID-19. If we can say COVID-19 tested, yes or no. And the next section, if it's yes, then another pop-up will show that please upload the proof. What do you think about it? Yes, no.
I just think we're giving them too much homework.
Okay.
For a welcome page, yeah. So we just want their basic, their name and.
We do want their email address. That we do want.
They already put in their email address when they signed up.
And a phone number?
The phone number would be in the next step where they verify their phone.
That I want. But everything else I think is just gonna be more homework for them. A lot of people are gonna be worried about putting that date of birth. Too much information, I think, that we don't really need.
Can we add it as just an optional field in the users page? That way I can just move all this stuff over that's already made and just put it into the users
But
page.
don't make it date of birth, make it month and year, because we don't really know the day. The day they were born doesn't matter.
Okay, so I'll change it to month and year.
Okay. This is just to know that there's another John Van Keppel that happens to have the same name, Jose Rodriguez. And then that way we know, okay, it's not the same one. He wasn't born in February of 77 or something, That's the only reason we need it.
Great, okay.
And we have the email address, we have phone number, we have so many other things.
Hold on, but that's a good point, especially down here. I wonder if we should have middle something, because we could have a lot of Juan Fernandez's or Jose Rodriguez, and the middle name is what could differentiate it.
I say we just leave the date of birth. I enter in my date of birth for things all the time. I mean, it's not that big of a deal. I say we just leave it. I don't think it's gonna would it really deter anybody?
I know it would me, but
I don't think people will be bothered to give date of birth.
Okay, so maybe just an age then.
But I don't think that's going to accomplish what you're thinking. And that, like I said, if there's two Jose Rodriguez's, they could really be born the same month and year.
that's true.
And so,
But they have the same email address?
well, that's true.
And we'll have their phone number and email address, yeah.
Okay.
Yeah, you get like
Okay.
3 or 4 data points.
Okay. So do we want to know their gender and their race? Is that,
I think so, yeah. I think that's easy, because the people can just click on that. It's not really identifying information.
Sure.
personally.
Okay, so we're taking out the date of birth, and that's gonna move to a different screen and we're gonna ask for their month and year.
Jack, one question regarding the potential use of people that are undocumented and don't have email addresses.
Oh, no, all undocumented people have a Gmail address, trust me.
So yeah, we can in our services we can create an email address for them, and we can manage.
Yeah.
it. Like,
What
then
we-
you switch the
Yeah,
app.
I don't think that some of these outlying things we can address. I think we should just get this so it's working just get it working. And then those other issues that come up, we can deal with them when they come up. Is that okay?
My reason for asking this is because I don't want to take away the date if it's really not necessary. Like if we're making it optional already, and they're already choosing to put in that information, then I don't.
I see what you mean, Camilo. It's optional, so it's not required.
It's
Right?
not required.
And equally the email, the ones that are starred are the ones that are required. But that one is not, like, it's optional. Email should be optional too, right?
No, email we need.
No, not the email.
Email we need,
Because
but we can get a
there's
hold
no
of
asterisk next to date tested, it's not required information. So when you look down this, you see the asterisks that are required, and then you see the ones that don't have asterisks, and they can click through without filling that in. So if they know the date tested, which again, I'm not so sure people aren't going to know because it's a pretty big deal. But if they know it, fine. But if they don't know it, they can keep clicking because it's not
Yeah.
a required
Well,
field.
yeah, let's just keep going because John's right. We should just we can always tweak it later. You know.
Yeah,
like
and every time we look at this, we're going to say something else about
yeah, you're right. You're absolutely right.
Okay, then we go down. So you see, I put in the date that I was tested, where I was tested, and then symptoms. Do I have symptoms or no? I'm going to put in symptoms, and it's going to ask me which symptoms. And then I can, click the ones that I've had or that I have, and then that's it for the welcome page.
Now, Camilo, instead of save, can it say next?
Yes, of course.
And like with an arrow, because the save thing doesn't look, you know what I'm saying? Like if I'm not so used to seeing that. It usually says next, and then it goes to the next screen, right?
Absolutely.
Great. Okay, so this is going to say next. And so now we've changed this because I think this is confusing. Phone number not set up. Enter your cell phone here.
Yeah. Please enter your cell phone. Mm-hmm.
And we also talked about down here where it says you agree to receive phone calls or text messages. I think we need to, if we're going to have that in there, it should say regarding COVID, because I'm not going to have just anybody call me for any reason. We need to either specify why they would be getting calls or take that off.
Just add you agree to receive COVID-19 phone calls and or text messages.
Absolutely.
COVID Fighter app calls.
Right.
Yeah.
Fine.
Because
Just put it before the word phone calls.
Right. COVID Fighter app.
Did you get that, Camilo?
You agreed to receive COVID Fighter app
Calls, phone calls, and or text messages.
Yeah.
And then I think we were going to have a little check there that they have to click so that they agree.
Well, this says verify, so that would mean.
Well, the verify thing, we also put something on verify that they have to click, that they will be getting a verification code because it doesn't, this pops up, it doesn't tell you that. So
You just got a verification code?
yeah, click for verification. It should say click for verification code.
Mm-hmm.
No, I thought the last one would send a verification code to your phone, and then when you get that, you enter it in here.
But it didn't say that. So on the past one should say click for verification code. Or
Can you go back or no? Can
I
you
don't
hit the
think-
close?
Or like click to receive your verification code,
Yeah, I can't
something like
go
that.
back. Wait a minute, can I
Or
go back?
just send verification code.
No, it doesn't let me go back. Now I'm in.
John, go back to the users page, edit your information.
Okay. So the top will say, please enter your cell phone number here. And you agree to receive COVID Fighter app phone calls. And then here, what my suggestion is, click for verification code or click to receive verification code on your phone. This doesn't tell them.
Verify doesn't mean that? I mean,
I'm thinking there's a lot of people that they're not going to know what's going to happen. I'm just trying to make this as very clear and simple. I didn't know what it meant. I didn't know whether somebody was going to respond to verifying me. I didn't know what it meant. So
Other apps usually say send verification code.
yeah, send verification code.
so just change that word verify, leave it in that box that says send verification code.
Yeah.
Right there, just have that say that.
Yeah.
Got it. Perfect.
And
Will
if
do.
we have a little click, it would just seem more courteous. That's it.
Yeah, exactly. Okay, so we do that. And I wait for, and also I think, are we going to get rid of, can we get rid of this 0?
Yeah, it's gonna auto populate into that space.
Okay,
What we talked about.
so
This is so cool. It's great.
Great.
then this comes up. but we're not having address. Is that right, Camilo?
Address is not mandatory. You can add it if you want.
But-
All of these fields are now optional. You have created a profile, and we have all of this data is can be reviewed by an admin now, and they can start assigning you to an agent, to
Okay,
a
we have
CTS.
functionality here. This is something that's not on the first page, huh?
Yeah, Camilo, I think the address you still have star on it because I assume that the ones with star is not optional, right? So
Yeah. I
All
would
right,
get rid of
guys,
the
I'm-
asterisk.
Yeah,
Get
I'll
rid of the
take it off.
asterisk
I'm
next to
sorry.
gender, race, nationality, and address, if we're not going to
Hey.
make it mandatory.
Good morning, it's
I'll
Sean.
take
I'm here. I'm on my
bold
cell
with
phone.
the
I don't know why
asterisk.
the Apple's not working.
We can
So
see you.
I'm here.
Hey, Sean.
Yeah, hey, I'm here.
Morning, Sean.
License is misspelled, Camille.
Well, I don't even think we need that. Do we? Because there's there's nothing, you can't do anything with.
Take that out. Yeah.
Okay, so we're taking off the asterisks next to these numbers, or these words. Is that correct? We're taking out license. And there's no way to put an address in here, so that should either be taken out or we need to have a place to put in an address.
There's
Aren't
a
you gonna
button-
want like the race and the gender for like data purposes later though? Isn't that kind of half
But
the
we
reason
still
of-
need asterisks on it, I guess.
Yeah, we're just not making it mandatory. I think we want it
Gotcha.
for the statistics, but it's not mandatory. But even under address and contact, I do think, agree that it shouldn't be mandatory, except for the contact number. But I think we're going to want to keep track by zip code and where these people are.
Okay, so but even with this here, there's no way to put an address in here, so it's very confusing. If it's there and you do go to put it in there, it's not possible.
No, you have to press the button with the pen. So
Oh,
To the right, John.
I can't get. It's like the camera thing. Okay. Oh, I see. The camera's in the way there.
Yeah.
Oh, what's that? Okay. All
You
right.
can enter it if you. Yeah.
what about the PCP thing? I mean, not everyone has a primary care provider, so maybe not make that mandatory.
Camilo, can we put something here that says, please click on pencil to put your address on here? Because we're not going to have a lot of people that we will have.
of course, I can make it like a little intro screen that like highlights the little pencil and
Right.
like a little note next to it saying, "Welcome to your user page. Click on the pencils next to the category to edit them."
I think you need to just have some words right. My suggestion is put words right here. Please click pencil to fill in address.
I would even suggest put the pencil in the middle.
Yeah, that would be the other way to
If
do
you
it.
just move the pencil to the middle underneath that's
Yeah. Make it a bar and just put the pencil in the middle,
Yeah.
like the American bar.
Yeah, guys, the information is gonna pop up there. So where you guys where that button is actually for cell phone recenses, for formatting purposes for cell phones.
Then I would just suggest that we have something there that says, click pencil or click box to fill address. Because I don't know what to do here.
Or we can just put a pencil and next to it we can put edit. The word edit, so that once they'll know.
Yeah, that would be good. Put here edit address by clicking on pencil, something like that.
or add address, because edit makes it sound like you've already done it.
Yeah.
Enter address.
Enter, perfect.
And then we would have to do the same. If we want them to put their PCP, we need to have the same thing. And also, is it PCP or PHP?
Primary care physician.
Primary care provider.
Okay, up above, we have primary healthcare physician. So we need to,
Provider instead of physician, primary healthcare provider,
Provider. Yes, provider.
Yeah.
and then take the asterisk off.
Right.
Camilla, are you able to get all this down?
I'm taking notes.
Yeah,
Okay.
it's primary care provider instead of primary healthcare physician.
Okay. And then this is PHP.
No, PCP, it's correct. But it's just that it needs to read primary care.
Camilo, do you want me to take some notes for you to send
Yeah, that'd be great.
to you? Yeah.
That way you
Let
can
me
send it.
Yeah, I can do that.
Thanks, Leslie.
No problem.
Okay, so COVID-19 additional questionnaire, and there should be two N's on N-I-A-R-E, right?
Yeah.
The questionnaire needs to be spelled correctly. When did you first suspect you might be, do we need that? When did you first suspect? Or we just need to know when they were confirmed, right?
Yeah.
Is this grammatically correct?
No, it's not. I'm trying to figure out also what you're asking for. Are you asking when did you first have symptoms? Are you
Or
asking
when did
were
you first
diagnosed?
notice the symptoms? Maybe
Yeah,
just use
when
notice.
did you first experience symptoms or something like that?
And
Yeah.
why are we asking this as opposed to the the test positive date?
It's just extra
Because of
data.
the virus life cycle.
It's extra data for the CTS. If people fill it out, great. If they don't, it doesn't matter.
Okay, well, let's
I mean,
reword it.
some people don't get tested right away, so you know.
Yeah, just gives you an idea how long they've been having symptoms for.
Okay.
Can I interject?
How can we?
When we did H1N1 contact tracing, we took into account that there's going to be a tremendous amount of variables. There's going to be a tremendous amount of people trying to understand what we're saying. So making it as simple as possible and leaving open-ended questions allowed the interviewer to narrow down what we're trying to, the information we're trying to receive in order to translate it and to pass it on to the health departments once we complete each contact tracing. So we're going to have, we have to be able to be pliable. We have to be able to bend here. So we can't overcomplicate it for the caller and we can't overcomplicate it for the tracer. So we have to have a little bit of, ability to move and bend when it comes to that. The goal is to find out something in the general vicinity of when did your symptoms start or when do you think they started, and it has to be up to the contract tracer. When you go through the contract tracing guideline, test training questionnaire, it's just trying to narrow down as best we can, because in the end, the public health department and infrastructure will go back to this case if they feel they need to be to be concise. But getting the data now starts the ball rolling and gets us closer to the objective, and that's mission critical.
Okay,
So why doesn't the question say, when did you first experience symptoms?
Then say that.
Yeah, and then we just have to calculate.
Because any ambiguity, we will figure. When I say we, mean past me. We would figure it out. We would know how to translate it, and if any questions arise that would skew the data, we would go to the source and talk to them.
Okay. Did you get that, Leslie? When did you first experience symptoms?
Yeah. So here's another thing. Anybody in here who's non-medical, please weigh in, because if you're legal or you're clerical or you're computer, this all together collectively is how we figure things out, because we're not going to all be speaking to doctors, nurses, and pharmacists and PAs and
okay. Let's just keep let's stay on point here. We got that. Okay. What were your symptoms? Do we only want these 4? Is that fine, Dr. Michelle?
There was, I kind of want to address the concern of a few of there's a couple of the Team 10 people that were saying that we should have asked about neurological symptoms. Maybe just add a category about neurological symptoms, because I don't know if you remember the last time we had this discussion, but they sent me articles about it. And honestly, I don't think it's important, but it seems to be important to some people. But these are really the things that we should be doing.
Also, doctor, these days people are experiencing the GH symptoms a lot, so maybe just add that.
All right, hold on. We could jump past it by just saying add a miscellaneous category.
Yeah, I like
put the neuro, put the GI, because we are looking specifically for respiratory, fever, ARDS type stuff. That's the general principle of what we're looking at. But if anything else pops in, yeah, it's important, and yeah, the NIH is gonna like that.
You can add something. I get it. Yeah.
Camilo, I don't know if you check the training, at the end of the training, almost at the end, it says determine the time frame. That might be the question that you're asking over there. because they say in the training, for example, the date and the time, the PUE first experience symptoms. So it says also that you can go back 2 days, 48 hours to start the isolation. So I don't know the time frame for that question. The time frame is important for the to determine the when is the end of the tracing. Because for example, if I have the symptoms today, I gotta count 2 days before, and that would be the 14 days. I don't know if everybody following me.
Well, I think that's what the question under when did you first suspect, or when did you first start having symptoms? That we're getting that in that question, right?
Yeah, you can check over there in the training that we had the CTS almost at the end. It says determine the time frame.
Right, but that we're asking them that in that first question.
This is objective, so we're going to have approximate numbers. It's okay.
Yeah.
Which is why I'm wondering if it's I'm wondering why we're even delineating things. I understand that we're asking them their current symptoms, and now we're asking them what their past symptoms were. Why are we telling them instead of letting them list us? Every day we see in the paper a new list of things that are being associated. And
it's very valid. That's very valid.
What?
Can we just put a tab like others, like they can write the symptoms if they have any?
Virginia,
I totally agree with us. You know, I have this like this one by the counties. I could share that with Camilo. I mean, there are about 6 standard symptoms that people actually list right now, and we could use that. And I mean, cough, fever, new loss of taste of smell, shortness of breath, sore throat. So I'll forward the information to Camilo. We can use that, then we add miscellaneous too. I think that will help.
But I don't understand why we're even suggesting things as opposed to just letting them tell us what they experienced in the past, not what they're experiencing today, because that we're noting, but the past symptoms. No?
We need a guide. We need something generic. Okay.
Hold on 1 second. Virginia, that's probably one of the most valid points. So we have to structure it around that because it'll not, you know what I'm saying? Like we have a training, we have an understanding of what we're trying to attain. If we allow them to state their subjective, then we can work with that. You know, it'll be easier for us instead of us complicating it by interjecting and putting in these different, we get their information and we interpret it based on our guidelines. And we see if it fits, and we can always just ask them the question, do you mean this? Do you mean that? And they say yes or no. And that'll be quicker. So I agree with you.
Can I say something about my personal experience? I have family member. He tested positive recently. The only symptoms that he experienced right now is he cannot taste or smell anything. You know, that's the only symptom. He has like a mild fever, like almost nothing, and he feels wonderful. He even wants to go, you know, to go to work again. And I recommend to him that he can't do that until he get tested again. And he said he feels great. That's the only symptom he has. But you know, since he has a BCP, he wants to go, you know, to make sure that he was negative or positive. So I keep following him and ask him every day, you know, how he feels, he has any new symptoms, and that's all he has, you know, that was all. And I saw yesterday, I saw yesterday in one of the posts, a chef, she tests positive, and that was the only symptom she has also. But after 41 days, she wanted to come back to work, but she want to be, you know, safe that she didn't have the COVID, you know, that she still don't have the COVID. And she actually does have the COVID, and she feels wonderful. So
okay, let's focus on the app here, because we need to decide what are we going to ask here. So one option is we could have a drop down with all the different potential symptoms we're asking about, and then we could put other, but then we're going to get random stuff, I would think. I think we should stick with what are the known symptoms and list them there, and they can click whether they had those, which symptoms they have.
It's fine, because when the way that this works is that when the other is listed, there's going to be a chart review. So we're going to review that. I'll review the others and determine where that it fits. And if necessary, I'll call back to the people to find out. We're not going to have a lot of others.
Camilo, is that possible? Camilo, is it possible to put a drop down here and list the various symptoms instead of doing it the way that it is here?
Yeah, of course.
Okay, and also, can you please write out shortness of breath? Some people might mistake SOB for something that's not pleasant, or they may not even know what it is.
That's a good point.
Or Camilo, add a.
That could be straight out of Boston.
Or Camilo, add an acronym page if you have to, you know, or somewhere on the
we
side.
just keep it really simple. Really, a lot of people are not gonna. There are gonna be a lot of people in here that just the simpler it is, the better. So, shortness of breath, I think, needs to be spelled out, written out.
Okay.
I'm going to echo this to John. Echo John. We have to keep this simple. We don't know the level of education that we're dealing with our population, but we do know that what we need is very simplistic. It's not complicated. It's a series of questions. It's a questionnaire. They fill it out. We do it. We go.
All right. The next one is so we're going to put a drop-down box with.
John, but click the edit buttons. You have to click the edit buttons to show what's going on. So I'm doing check marks because there might be multiple ones.
Which edit box do you want me to go to?
I mean, depending on the question, each question has a custom type of input.
So uncheck one of those, John. Go to the edit and uncheck cough or something. Yeah, just uncheck it. Now go back, save. Let's see what it looks like.
What's the account number for that patient?
It's, I don't know. It's me. It's, how do I find that?
Yeah, it's not doing anything.
Okay.
Yeah, John, you unchecked it, but you never checked it as confirmed. We went over it yesterday. We're gonna change it so it's single click.
Yeah.
But I've done this like nonstop, day and night. So I've literally I'm just trying to make it work.
That's okay. This is for this purposes. We're really just showing how this is supposed to work, and so you can, for the glitches on this one right here, you can.
The problem with a drop down for that question is that the drop down is only going to allow you one answer when you're not going to be able to check mark. Now, what if you have multiple symptoms?
Okay, well,
check mark 2 of them or 3.
So how do we fix this, Camilla? What's
Can
the
we
best
just-
way? Because it's confusing. It's confusing to see under there things that are the red and then having to go to the pencil on the right. I don't know how those interact. So I don't know if the one confirms what I've done on the right or it change. I don't know what the. So you're saying in order to answer what are your symptoms, you have to hit the pencil. On all of these, in order to answer the questions, you have to hit the pencils. And then you see, then why are the symptoms even under there? Why don't we just put the pencil there?
Yeah, I just threw it there. They don't even have to show up there until they answer.
Okay.
I just did it an indicator because I was rushing through it, honestly. It's not the prettiest work, but I just was working on the functionality. The reason why I'm specifying that we need to work with check marks there is just because they might have multiple ones.
Okay, so it sounds like what we need to decide is what other symptoms we want them to indicate, and then it's up to Camilo to figure out how to do this on this system. Is that right?
Camilo, can I say something to you? When we're done this and you start to go do, like John just pointed out, you'll go back to, I'd like to be there with you and go through it with you. So you're not doing it alone. You know, so you schedule talk with me, however easy it is, you can just do it by phone and I'll answer the questions because again, I've done this before with H1N1 and Ebola. So in the public health capacity. So let me stand by you and help you make these decisions and then we could review it, you know, with Dr. Jack and John and everybody else. And I think that'll streamline it quicker for you and take a little bit of the burden off so that you're not sitting there having to make decisions on whether, you know, if you get hung up. So let me shadow you while you're doing it.
Okay, so you guys, between the two of you, you're going to decide the what symptoms need to be on there. That's the question we
Yes.
need to resolve here.
Yes.
Yeah, I was handed an email with a list of questionnaires that they wanted me to specify. These are the questions. Of
Yeah.
course,
So
work with the material and
Camila,
you guys
I just sent you a slide that will help you with our question. I will send it to everyone.
Great.
Okay.
So let's just, so that's what Camilla will add the other symptoms there in a way that they can indicate multiple symptoms. That's the issue we want.
So I'm gonna get rid of all these red things, and
Got it.
only something's gonna show up after they click it.
Right.
And it's gonna be single click. You don't have to click it twice.
Okay.
Perfect.
And then, so the next question is, how many people live at the same address as you do? And they can indicate that here. And this change. Let's see, this changes. Yeah. So then do you have support to help with shopping, preparing or delivering meals, and checking in on you?
Question on that one, John.
Yeah.
What if they have help preparing meals, but they don't have help shopping, or they have people checking in on them, but they don't have help shopping?
I think, yeah, you bring up a good question. We're just trying to give a selection of things, and maybe there need to be other things. But what my question was, if they say no, what happens? You know, what do we do? Because that's putting a burden on us. We're just asking yes or no questions, or do we?
So why are we asking this? So that we can help provide that to them, or why are we asking this question?
That's the question.
Anybody?
Yeah. The patient, the family member that I told you guys that has the COVID, they really concerned about help. Besides what the emotional support, they're really concerned about the food, for example, because they cannot go outside, they cannot go to cook in the kitchen because they don't feel well. So here for example, in Miami Beach, there is a number that they can call the city, and the city provide food for them. They actually drop it at the door, and it's cooked meals. So when they ask for help, just call the city and help them with the meal at least.
Right.
So that's what he did with him. He's gonna receive the food. I think once or twice a week. He doesn't have to cook or anything like that. Just put it in the microwave, and it's a healthy food.
Right. But our question here is, so they say no, then do we have to direct them there? What is our role in helping?
So if they say,
Yeah,
I'm going to answer that.
So
allow me to answer that. The state and federal government, in order to get federal money, they have to follow and agree with federal guidelines. States can make their own guidelines. Cities and municipalities can make their own guidelines. They have to, if they're going to take money from the federal, they have to. But the thing here is that what that means is that all of these kitchens, whether they are state funded, federally funded, or privately funded, like religious organizations, they're all in a compiled list at the state. I can get those numbers, and we could put those resources on the site so that they can choose, and we could just direct them to that and allow them to go from there. Because we, again, are just here to collect the data to flatten the curve. If we do have somewhat of a responsibility, but that responsibility can be translated by putting it in text and allowing them to say bilingually or trilingually, whatever, to go to this part, and here's if you answered no, go to this, go here. Here are your options on where you could go to get food, get supplies, get whatever. And we'll do that to the best of our ability. Again,
So is it possible to put on here, if you need support with shopping, preparing, delivering, or checking in on you, click here and we put the links to that information?
Yeah, so that's great, Virginia. That's great, Virginia. I think, when they get to our CTS, I saw the presentation Dr. Sean sent to everyone this morning. The CTS will have like information on resources, and from this questions guide the the user if they get to us at that point, so that we don't like put a lot of information on board them. So there's someone at the other end, at the back end, looking at this information.
Then I think I would like to suggest that we would take this sort of a question and move it to the end, where we end our conversation with them, like, do they have this support?
Absolutely.
So then we can give them a list.
That's a great idea.
But
But then we also then have to train the CTSs to know where to find those resources for every municipality.
I'm going to put together a manual for CTSs. That's the way you handle this. We put a manual that has all these things. It's a backup, and we'll do that, and that'll fix it.
So
I agree. I agree on that.
Okay, Camilo, for now, can you take that question? And we're going to put that at the end because it doesn't belong here.
Yeah.
question. So we're gonna have to do it by zip code, for example, because Miami Beach area is not the same as North Miami Beach. In my case, here that I live in Miami Beach. So when I have like 3 phone numbers that can help with that kind of support with food and everything. But there, for example, Miami is another phone number. Miami Beach area is another phone number. So how are we gonna, for example, the CTS, they're gonna be assigned by zip code?
Well, that's going to be what the manual does.
Yeah, that's Dr. Sean's. We're going to sort that out when we get there. It's no problem at all.
Yeah, that'll be fixed. Don't worry about that.
Okay, great. So we're going to keep moving. We're going to keep moving here. One, so we're not having that question. So after how many people and the same address, have all of the people in your home been tested? It should say tested for COVID-19.
Yeah, John, I'm going to put my 2 cents on this one. I don't think all is a tough word.
Okay.
Because I think it should be any. Have any of the people in your home been tested? And obviously there's a typo there on people, because that presumes that everyone had to have been tested for them to keep going.
Right.
So have others in your home? How about that? Have others in your home been tested?
Yeah. Okay, perfect.
And I think also to add, we should put SARS-CoV-2, not COVID-19. COVID-19 represents the disease. The virus is what we're testing.
The general public is not going to know that, Sean.
Yeah, they're going to get way too confused.
I know, but for our data collection,
I totally agree with Virginia on that one.
I know, but for our data collection to submit it, we should differentiate the two.
They won't answer the question.
I agree with Virginia on this one.
The test results will show that, Sean. The test results will show that.
Yeah, they're gonna think, I don't have SARS, I have COVID. So.
Right.
Okay, that sounds good.
Okay, so have others in your home been tested?
Right.
I have written down, have others in your home tested positive for COVID-19. Is that good, or do you want it different than that?
Well, do we care whether any of them have been tested and are negative? Does that matter? If it doesn't, then she's right.
It does matter if they're negatives. So,
it does
yeah.
or does not?
It does. I mean, it's good we have that information. At least there's no spread within the home. So, yeah, tested will be my suggestion.
So just tested. Okay, but then that kind of does open up another question: are they a positive or negative? So, but I can just rephrase it. So, like I said, if it just says have people in your home been tested, well, what does that mean? Were they positive or were they negative? That kind of does matter. So. That's why I thought maybe just positive.
We'll just put tested and what were the results? You know the results.
Yeah, so it'll have to be a second question then.
Again, what are we doing here? We're collecting the data to pass it on to the authorities in order for them to make the national model. That's how it gets flattened. So some technicalities are going to exist that we have to get. We can translate it ourselves and go back if we don't know the answer and get it translated. But that's be very.
Okay, so I'm going to make it a 2-part question then. Have others in your home been tested for COVID-19? Were any of these positive? Something like that?
Yeah.
Well, and if they are positive, then what do we tell? What are they supposed to do with the people who tested positive? Have them contact us?
No, we'll have an algorithm for that, and then. But part of what we're reporting to the state and feds are going to be positives, negatives, symptoms, because they're going to be sorting those data points out for their research and model.
So we're okay with saying, have other people in your home been tested? And what was the second question? The follow-up, was that Leslie?
If they were positive or negative, because right now we're just asking if they were tested. So
yeah, if yes was the result or something.
yes. Yeah, I like that. Okay, so if yes, what were the results? Okay, that's fine. I'll send these notes to everybody too, so you can add them. And
address that part. If yes, I wanted to ask a pop-up that just says, when adding people below, make sure to indicate which are COVID-19, because the next question is identifying the people around you.
Okay.
Family members, everybody. So there, I would believe that it would be better to just add a section for each person that you're identifying if you know they're COVID positive.
Okay.
If they're the
so
one.
If they say yes to have others in your home been tested positive for COVID-19, then it's going to make another thing that says what exactly, so I can write it down. Who and what were the symptoms? Like
please
how am I?
make sure to list.
Okay.
Please make sure to specify which people below.
Just please provide names.
Yeah. Okay, I'll put something in there and then I can highlight it too, and you guys can work on it too. But I'll just at least put something in for now.
Okay, and this is where the real contact tracing comes in here. We ask them to identify all of the people you have been in close physical contact within 7 days prior to testing positive for COVID-19.
I have a couple questions on that, John.
Right.
Because close physical contact, I know what this means in this context. I don't think the general public will. And doesn't the time frame make a difference? Not the 7 days, but for 30 minutes or more? Don't we have to say?
If you read down below, for example, anyone you have had conversations with for more than 15 minutes, anyone you have shared a confined space with, transportation, office, restaurants, bars, homes.
So I actually looked up like the definition of what like a close contact was, and it's less than 6 feet for more than 10 minutes. Okay. So that's, if you wanted to put that exact thing, that's what's
that follows with all the other information that people are putting.
Yeah. So, and all right, I can put that down there for the people. Okay.
Okay.
Yes.
And Virginia, does that answer your question out in the examples down here below? Does that help with what you were?
Yeah, I mean, it's a little wordy, but yeah, what about, and is 7 days what we want?
Yeah, that's the other question. How many days prior? Dr. Jack, what's your?
Sorry, what was the question again?
How many days prior to being tested do they need to go back for contact tracing?
The course said we had to go back 14 days, right?
No, I think that was forward. I thought it said like 2 days, and then
That's
we go.
what I thought too.
Wait,
2 days from symptoms.
No, but when you're positive, right? Let's say you're positive today. The longest incubation period could be 14 days.
Oh, so I think what they said was 2 days before you started seeing symptoms.
Correct.
I don't think it was connected to the testing date.
Correct. But I think for the testing date, you have to go back 2 weeks. I mean, for sure.
Remember, there was a question on the CTS certification. It said, you know, day this, and then how many days prior, and it was 2 days, right?
No, that's symptoms.
So it was on the 5th, and they went back to the 3rd, and then the 3rd on, right? Remember the vignette they gave?
I mean, this questions and information keep changing, but I was just wondering, how much do we need on this app? How much data do we need to collect on this app without boring the users? And how much do we need to have our CTS know so that it could follow up with the users rather than have them put in all this information?
But Obi, this is for the contact. Obi, this is for the tracing. This is now we're going to contact those people.
Yeah.
Yes, but someone from us could reach out and, you know, fill up this detailed information.
No, but it's always helpful for them to fill it out if they you know, it
They have it. Okay.
But honestly, from a medical standpoint, if you know that you have a disease that has a incubation period of 2 to 14 days, it makes sense that if you're positive, you would go back 14 days from the date of the testing, not 2 days.
No, I think it was 2 days from the date you first started seeing symptoms.
That's different.
That's
And
correct.
exactly, but I'm wondering if because we're going to presume that the symptoms started on Monday, they weren't tested for another week. So if we tie it to the testing, we may, and let's say they had symptoms 3 weeks ago and they just got tested. Do we want to tie it to the test or to the symptoms?
What did the vignette say? It said, does anybody remember what the vignette said? Because that answers this question. That's why it came up in the vignette.
Let's look it up on the course, because the course is pretty specific about those dates.
Yeah, that was almost at the end to determine the time frame.
Yeah, I'm pretty sure it's, you know, I might.
Absolutely. Categorically, it's there.
Can you just mark that we're going to look at, we need to verify the days. We need to verify that. So that's
based on the guideline. And then let's go to the next one.
Okay. So you'll see here that the drop down box asks, please identify all of the, oops, that's the wrong one. We got the places in the wrong, yeah. Oh, I see, it's just the title was wrong here. Okay, so this title, it should be, we've got 2 drop down boxes. This needs to be changed to say, please identify the people. So this is
I think you just hit the wrong click. Go to the one above that.
I didn't. This title is in the other one as well.
Yeah,
This says name. So let's go down. This is for the information we're asking from for them to give it to us. Do we need anything else? This says new family member section. Camilla, what is that?
It's just words.
Okay, we can take those out. We don't need those. That'll be confusing. So we're just asking, so that we're asking for name, relationship, email, phone, date. What date are we asking? Camilla, what date they were in? Date of they were last with them. Date.
The date of that encounter.
Date of contact.
Date of exposure.
Date of well, I don't know. What? I think we've asked for contact, so exposure brings in another word. I think date of contact is probably better. Okay, date of contact. Okay. Location. Do we need that? So we're asking a location from them. Are we asking for an address or a thing like home or at the beauty shop? What do we mean by that? And do we need it?
We might need this, but it would be like grocery store or a barber shop or something, because it might help us in contact tracing later.
So we'll just leave it there and let people put in whatever they're.
So can we just use places you've been to instead of location? Because location, I don't know.
Well, this is specifically for where the location where they encountered that person. So you're saying place of contact?
You know what it could be is.
I was saying places you've been to.
That's in the next question.
It would actually need to be where are places that you've been where you've been in contact with people under 6 feet for more than 10 minutes. Because that's what we're asking.
Right. So this would be the location where they were with that person.
So it needs to be location where you were with people for that close what we were describing as close contact. Because we don't want people to be like, oh, I went to the gas station. Well, that doesn't matter. You didn't see anybody there. So it's kind of like we need to identify the places that they've been where they were in close contact with people.
That's going to be a different question. This is
okay.
So we're just we're down here. we just want them to identify where did they encounter that person. Could be
Okay,
the
so where did
I
they
would,
encounter?
I would suggest we use the word location rather than places.
Okay.
Sorry, it's a typo.
Location of contact.
The title here is supposed to say places. This is the places modal.
No, this is actually the.
I mean, sorry, the
This is
people
the-
modal.
Yeah, this is, I put that in my notes, so it's okay. I get it.
The title has a typo, which is supposed to say people.
Yeah.
Yeah, I have that written down. I got it.
So in the location, can we say location of contact? Does that work?
I say
Okay.
we
Yeah,
just
that
leave it as
sounds better.
location. I
Okay.
don't know. I say we just leave it kind of simple and just let people put in if they want to put in.
So this one we're asking for the people, and this one we are asking for identify the places.
The places. Okay.
I just had a quick question. What if there are like multiple people?
They need
They
to
can
list
just
people. They
pull
need,
multiple things in.
that last one, they would have to list everybody. So each person would have a different, their own sheet. So if there were multiple people, they would each get one of these.
Nice.
Yeah, I'll just say, like Camilo and the I think we have the definition of close contact on the chart by Dr. Sean. We should just take a look at that.
Great. Well, you can send that to them so they can then change that if we need to. But for time interest and this is basically how this operates. But if we need to change the wording, that's fine. Please send that to, circulate that to us. That would be great. But okay, so.
Isn't this too much information for them to fill? I mean, if someone's not feeling well, would they be sitting there and filling all of this?
Well, but this is what contact
I
tracing.
mean, they should.
Yeah, that's what we have to do.
They're not gonna answer the phone if they're super ill. So, you know, or will be advised by a family member they are too sick to come to the phone. So under that principle, I think we're doing all right.
Yeah. Okay.
Yeah.
Camilla,
So do
I
we
have another
have?
question.
Can we? Okay, go ahead, please.
No, I'm just wondering, Camilla, this may be completely off base. Is it possible to put this into some type of Google Docs that we can just help with the language, help with the wording?
So what I'm doing right now, I like kind of describing what we're talking about, and I have it on a Google Doc, and I can send it to everybody so you can kind of change it around. I'm trying to make it a little bit like that. So if you want to go off of that.
Easier for everybody.
Yeah, I like the fact that we're thinking about the user that could be very sick. So I would like us to put in some information somewhere that we might authorize a next of kin to speak on their behalf or complete this information on their behalf.
Well, actually, but these people, they've signed up for this. This is a voluntary thing they've signed up to do. So they're going to know what
it's already. The national guidelines have addressed that there could be a proxy that answers the questions for them, because the data, again, is more important than not getting it. So, and I know it sounds very rudimentary, but it's exactly that. We need to get this data.
Is there a point, like somewhere, to mention this is being completed by a proxy? You know, just something to tell us that is not being completed by the user.
John answered that when he stated that, you know, patients who are volunteering to give this information up, that covers it. And I think that the guidelines, I'll try to find it. I know it's around there somewhere. I'll get it and pass it on in Google.
Okay, one other question.
Yeah.
Just understanding the concept. So what this is doing is we're asking them to begin the conversation that they're going to have with the CTS, correct? So this is we're gathering information, and then the CTS is going to be asking more questions, or are we trying to get 90% of the information on the app without the CTS involvement?
Yeah, that's what we have to decide. We have to decide that.
Virginia, it should range between those.
Yeah, we have to decide that, because if the CTS is going to, if the app is going to collect all the questions and the CTS will be asking clarifying questions, that's a different point. But if it's like we want to get them in as soon as possible without bombarding them with too much question, I want to get them with a human on the other side to talk to, then I don't want us to do too much on this app.
Okay, let me just jump in here. The CTS is already certified, some quasi-certified based on the website that they go on and certify. What that tool is doing is showing that they have the critical thinking skills. That's why there's an exam, in order for them to improvise, adapt, and overcome any situation. And then having moderators and administrators and regional heads be able to answer or troubleshoot anything that comes their way. Because again, what we need them to do is just gather the data, the data points that the CDC, HHS, NIH, everybody's looking, WHO are looking for in order to make the models to flatten the curve. We're not trying to treat patients. We're not, CTSs are, and this contact tracing is just one goal: get the data, give the data, and flatten the curve. And if we keep that principle, and then we do like what Virginia's doing, is troubleshooting and finding these little loopholes, we close them as much as we can to limit the need for the CTS to improvise, adapt, and overcome, because we could foreshadow it somewhat. And Virginia, again, you're doing a great job at that, and John organizing it, and Obi, everybody. But we have to keep this stupid and simple, or simple and stupid, because we got to get the data, we got to flatten the curve. All these other things, there are other departments that we could send them to, we could follow up, the administrators can do all that, you know.
But I think, Virginia's got a very good question. If the patient opens this up and they start answering their questions, there may not need to be, there may not be a need for a CTS to contact people who are, can do this on their own and don't want to be engaged with a CTS, but there will be others who will need it. So
that's right, and we'll determine who needs what, because
if somebody gets, if the CTS gets the information that there's a new patient, they can call them up and follow up to find out, are they able to fill this out on their own, or do they want help filling it out?
That's correct. That should be that way, so that we don't have to call people when we don't need to, unless we have to straighten some answer out. But if they finish the app and they don't need a CTS to call because they did it themselves, then that's helping us expedite this quicker.
Hopefully that's the last question, along with the social. Do you, maybe after they do this, then they can think about whether, oh, I've done it all, or I need help, and we give them that option at the end.
Yeah. Okay, let's just, we have one last question, and that is the question on place, where people have been. So we want them to identify the places they've been in the last, again, this will be the same 7, it'll be like 14 days or whatever that that is. Location, the contact person at the location. So if they know they were at a restaurant or a beauty salon, if they could find out what that number, they may not have it, and that's okay, or a phone number and the date they were there. We have this category down there. I don't think we need it. So we can, I think we can take that out, or what?
Yeah, we could just leave it.
So,
I'm concerned about the contact person there.
Let me just, so when we did rabies, because we did rabies also, so our contact tracing with rabies, if we just got in the vicinity, there's a way to just narrow it down by searching the vicinity. So whatever information they can give us pertaining to the location, we'll be able to find it. You know, it's not the 1980s anymore, so we'll be able to geolocate it pretty quickly.
And is our goal then to contact that location and say, somebody tested positive, was in your store, was in your, again, a restaurant, I mean, it's got to be more than 30 minutes or whatever, which is why that has to be really clear.
I think that's true, but that has to be taken to another step. That anything, that's why I put at the end of my thing that you guys will get, I said that if any potential mass casualty event or exposure, contact the person in the CTS, or the if we find it in the report by the caller or the app user who doesn't call us. If I find or hear anything like that, I'm going to immediately contact the liaison for the public health department of that region and explain and report them to the case. Because I could just report a case to them, and it's their duty to follow up on that. They can use me as a contact for the COVID Fighter app.com to answer any questions. And I've done that before, but through the public health capacity. So, and the Poison Center as a proxy for the public health department.
And is it important for the patient to know that? Because again, it may be a restaurant that they go to all the time, or the hair salon, or something, and they don't necessarily want their name used. So is that something that we can put that, because they want to know why you want to know.
That's fine. And then we just explained to them that because the potential for mass exposure is involved, we will not use your name. We will just report the case as a number and a concern, and the public health departments will facilitate their departments that go and investigate that. Like a food poisoning. We also do food poisoning. So it's like that.
Okay, so that brings up a good point. Camilo, can we put, where it says new family member section, can we put that disclaimer down here? Your personal contact information will remain private. They're not afraid of being exposed to, I told on them. So
I honestly wouldn't wait to click to say that, because if we wait till the page, if you don't put it on the original page, they may go, I'm not going to tell them, and they just move on.
Okay, but I agree with that. The concept already exists. The protocol and concepts already exist for rabies, food poisoning, anything else. It's already there. We just utilize that and word slot ours into it by stating all information is kept confidential. Anyone we contact outside of, we will not use any patient identifiers, however you want to put that in regular English, but that's how the system already exists, and it exists for the 20 years that I've been doing it. It does not change. We will always contact the facility.
I do think we need to put that on these pages so that as they're seeing this, they will remind them. Yes, I agree. I thought we had it someplace earlier, but it needs to be.
I agree with that. I agree with that. And, from my experience working at Genentech, we launched Ocrevus, which is one of the first FDA approved medication for multiple sclerosis. So the first thing we do as, people either on the phone is state those disclaimers, right? And equally state disclaimers like maybe the call is being monitored or recorded, stuff like that, so that people get that information and build trust early. Yeah.
Great. Leslie, can you put on your document, just remind us that we've put that disclaimer at the beginning of this? I thought we had it. It just may not be on here, but if you can put that as a note, we'll include it.
Sure.
And then down here, that's the contact tracing questionnaire. So Leslie's going to send those comments out to us if you have other thoughts. But again, let's remember to keep this simple.
Keep it simple, stupid.
Yeah. And any overarching responses to this? Does it seem overwhelming? Does it seem doable? Does it seem intrusive?
It's good to me.
Based on my past experience, this is perfect right now. We'll agenda it.
I think it's pretty timely. Yeah.
Yeah.
Yeah, I think it's great. I think it just needs tweaking, but I think it's great.
Okay, so let's move on to, now it says, because we're really past our time. So this whole thing, a COVID positive test result. If they do have a test result, they're going to add it here.
Then what are all these other words?
I'm sorry for the mess, guys. I've just had so much data.
Okay, no worries. Just tell us that. Camilla, just tell us this section isn't finished yet or something, and then we won't even spend any time on it. It's fine.
Yeah, it's finished. There's just some words additional there, some extra words there.
Okay. Well, we'll get those taken off. And then plasma donation. So we've asked them if they want more information, or yes, no, or they want more information. And then that's going to be linked to the plasma donating people. So here, down in this follow-up support, I think that question that we asked, it might be a better place to put that here, or just leave this like it is. I think it's like leave it open. So we're not.
Wait, can you go back to click on the request more information on plasma?
Sure.
Okay, two things. I'd like to help you with the wording on the paragraph, but also I thought we were just going to click through to the plasma donation team? If it's a yes, just, it could be yes. Okay, so if you click yes, what happens?
Well, the plan was that a notice goes to the plasma donation people.
And Camilla, is that going to be up and running?
Well, can you note that, Leslie, that we need to be sure that that connection gets made?
Okay.
And the same would be, is that enough? Or there, or did you have anything else in there, Virginia?
No, I just get, again, yeah, I would like to help with the wording on that.
Great.
On that first 3 lines.
Super, that'd be super. Leslie,
Yeah.
can you type that? Can you put that in your document, those lines, and so that Virginia has that?
Which lines? Say one more time.
Plasma donation opportunity, because even opportunity is not spelled correctly.
Yeah,
I wrote that. Any misspellings I've actually noted, so I've got all of it down. So I just put that we need to make sure that there's a connection there for it to connect to the plasma center, or what am I wanting to do here?
To the link to the plasma donation team.
Okay, perfect.
I have a question, John. If the PUE asks you when it's going to be safe to get out of isolation, should we tell them they can go do the test again in 14 days?
That's more of a doctor question, not this kind of doctor that I am, a medical doctor. So,
what was the question?
If the patient asks, like, when do we think it will be safe for them to, get out of the isolation?
Any question like that arises, the answer should be phrased according to, or please refer to the CDC. So if you have the answer right there because you're looking at the CDC's frequently questioned answers for frequently questions, or if you don't know, it should just be easily said, please go to cdc.gov for that answer. Because again, we don't want to become their care provider. We just want it. We're scribes. We're data collectors.
No, but you know what? Let's go to cdc.gov and just find out what the answer is, because I think the answer is, unless you're a healthcare provider, in which case you need to have 2 negative tests in 2 consecutive days. There's no real need to retest unless your employer requires it. So I think Virginia and I can come up with something.
For the purposes of when in doubt for the CTS, so when in doubt, if they can't answer it, then it either has to go, they have to have something, right? So I agree with what you're saying, but there's a backup just in case they don't know, whatever.
Yeah, we can give them the answers though. Right. That's the point. We can, those are concrete answers.
Yeah, why create the anxiety?
Yeah.
Right.
Yeah, that's a very good question. I mean, Sean, I know you're taking notes for the guide or the book, the training model for CTS. So that's a very good question. We should include it there, and equally have that disclaimer you talked about.
I'm going to put CDC's frequently answered questions.
Yeah,
frequently.
I know there's a link, Virginia. It's actually, if you look at it's in the packet that we got. It's in that course.
Yeah.
There's a link to that, and you could just give the CTSs the narrative, and then they say you can go to this website if you want more information, and that's it.
That's right.
You're reciting what the CDC is saying. You're not doing anything different.
Camilo, I don't like on these 2 boxes here, the plasma donation that's bold and has the asterisk, and the follow-up support and that's in bold and has the asterisk. I don't think we need those because we've already got the plasma donation opportunity up above and follow-up support. I think it's a bit confusing.
If we can just move the boxes over to the middle.
Yeah, exactly. So you can take those out and then move the boxes to the center.
And then
on the change. Go ahead, Virginia.
On the follow-up support, isn't that where we're going to also put the social support? So under follow-up support would be 1 question with regard to social support and 1 question with regard to emotional support. But then we also need to figure out where those links are going. The link for the emotional support will go to our peer support group. But I don't know about the social support. I don't know if we want to be offering something we are not going to provide to them.
I agree with that. I don't know. I would say we don't ask that because
that's my point.
agree too.
Anytime that comes up, the answer should be exactly no. You know, if it comes up that it's a hindrance to what we're doing, then the answer should be defer to another option.
Okay, let's keep moving on this here. So the next one, become a contact tracer. Well, this is a I don't know that we need that in here. They are a contact tracer, right? No, this is.
No, this is for the patient.
This is for the
Wait.
patient. You're right. I'm sorry. So do we want that question in there?
I think what's actually more important is having someone who's already had it be a peer support for somebody who gets it. Because I think that when you have it now and you can talk to someone who previously had it, I think that is a wonderful resource.
Remember, we have 400 or so people in this team, but we have 1,500 positives. So that's a great recruiting.
Great. Okay. Well, then we'll leave it in there. But the CTS on the title, we need to make that a capital S, not a small s.
I would actually again like to volunteer to help work out the language of this one. That's going to focus on both the CTS and the peer support.
Okay, you'll have that in.
What? One. Huh? It's one. Yeah.
Leslie, Virginia, Camilo, the three of us, the four of us should get together separately and go over all this. And what we should do then is present it to John, to let John organize it, and then give it back to Camilo to put it in, and then let Dr. Michelle review everything and edit it, what he thinks, and then we should go from there. Because I think we're going to solve a lot that way.
Okay, we can work that out. Great. Account details, do we need this?
I say just leave it.
No, I can take it off. I have to clean it up anyways.
Okay, great, thanks. Okay, I think that we've walked through the questionnaire. We haven't done the CTS side, but I think that this gives us a good idea of how this works. I think doing the CTS at this point is going to take us well into our meeting. What do you guys think?
I have a question.
Ask away.
So if we are going to provide the social support, as in groceries and stuff, we need to have the address there. That should be a must.
We said we're taking that off. We're not including that.
We don't have the resources to provide it, so we want to make promises we can't keep.
Okay.
Or expectations that we're not going to meet.
Okay.
Which number is it?
Okay.
But can at least we give them the number for the organizations in the area that might help them?
Yeah, that will be part of the manual. The manual will have all this information.
Okay. Okay, this is very helpful. The plan is we should be able to go through this much more quickly, I hope, on Monday, because we want to be able to also show the CTS sides, because that's what they'll be working with. But basically, people have gone through and Camilo is still finishing up the updates on the comments that he's gotten. So let's wait for that till Monday, because we should have that streamlined. And CTS is basically the questionnaire side is the same as this. So it's no different. Does that make sense?
Yes.
Okay, so then that's it. We can see that once this is done, it's streamlined, it's user friendly, and it should be very easy to work with our patients. So that's all we have for the presentation. Camilo, once again, thanks. I know you're busy working and doing
Yes,
this.
Camilo, you're great. Thank you.
And Leslie and Mary, thanks for getting your notes, or Leslie, your notes. And Leslie and Mary, thanks for your working on these instructions. I know that some may change, but at least you can get your outline going. So greatly appreciate that. And now I think we have just a few things to say for people who are the regional heads, because we have a few instructions. Virginia, were you going over that? Oh, you're muted. You're muted, Virginia.
Thanks. Can you not share your screen?
I'm going to go off of this. I'm going to figure out how to do that.
All right.
Stop share. Okay.
Okay, good. Great. I just like to be able to see who I can see.
Yes.
Just real quick for the regional heads, I do need you to send me your lists of the CTSs in your region, and let's keep that updated. Let's put that in one place where it can update as we all amend it, and it'll keep track of the numbers. Eventually, hopefully, we'll get that in a database, but for right now, it's just in the Google Sheets. It'll also help us when the assignments take place to see who needs patients and who doesn't. We've got some regions with only 3 people, and we have other regions with 60 people. So we don't want to leave the regions out that only have a couple, and we don't want to overload the ones that have so much. So we need to be able to have all this information in one place to be able to utilize it efficiently. Obviously, we are keeping track of CTSs who have gotten their certification of completion, and we are requiring that they have that before they're assigned any patients. And so we need you to, you know the course. The course goes from Jimmy. Michelle is going to be assigning the patients' names who are going to be traced to Lynette. Lynette is assisting Dr. Michelle on this, and what she'll do is she will assign them to the regions, which is why the regional information needs to be in one place. So those assignments will go out to the region head, and the region head will assign them to the contact tracers within your region. You're going to need to keep track, and I'm hoping we'll have a database by the time this starts to where the efficiency of keeping track of who's doing what will be streamlined. But that will be your responsibility to keep track of that so we have it accurately and in one place. We are asking that the CTSs, and we probably need to talk about this, the CTSs will have questions that go to the region head, but then they will also have questions that go to the supervisor. And at some point, we're going to have to delineate what those questions are and where they go so everybody understands who they're to call. Sean has been gracious enough to offer that he will be there to answer questions 24/7. I love that. I don't think it's feasible for any one person to have that responsibility all the time. So we need other people. Do they need to be healthcare providers? I don't know. You guys need to decide that and tell us what you want, because I don't know.
I think they should have public health experience of some sort.
Say it again.
I think they're going to need some sort of public health experience, because there's a mannerism that is the training that we have, you know, and to handle those questions and think like a public health specialist.
And are you equipped to train if we said, okay, we need
Absolutely. 4? Absolutely.
Okay, so maybe we need to keep that in mind based on the number of patients and the number of CTSs that we have X number of supervisors.
Virginia, I think the one of the articles that I sent on NPR, it was saying 10%. So basically for every 100, you need 10. So it's like 1 to 10 supervisors to CTSs.
All right, so that's important in the next week or so to figure that out and get Sean to be training who those people are. How do we, if he's saying they need public health experience, does that mean, Sean, that they need to be, do they need to be healthcare providers or healthcare trained?
It could be,
they have to be a specialist,
like, for example, Obi, he's a international medical graduate, and he's also an MPH. So all the MPH, right. But Obi knows a bunch of people. I think all we need right now is for every 100, we need 10.
Okay. Yeah, we have information from our quick survey that will, you know, guide us. So yeah.
So I'm going to leave that to Obi and
all MPHs are automatically qualified.
I hear you. So if we have 300 CTSs, then we only need 3 supervisors.
No, we need 30.
30 supervisors.
It's
okay.
10 for each, yeah.
Every 100. All right, so I'm going to leave that to Obi and to Sean. Obi, you're going to identify who can be supervisors, and Sean, you're going to train them.
Right.
Okay.
And I have the experience of a supervisor on that level, so I can handle all of that.
Okay,
yeah,
perfect.
We'll work it out.
Okay, perfect. And then lastly is as the region heads are dealing with their CTSs and they're making assignments, somehow we have to figure out, because these are all volunteer positions, and some CTSs have an hour a day and some have an hour a week. And I think we need to be mindful, and we need to be respectful of these people's time. I'm not sure how we keep track of that, but as a region head, I would like you just to be thoughtful and help us come up with a system so that we don't overload our CTSs, we don't overload our volunteers, we give them the meaningful responsibility that they want and the job that they're doing, but we don't want to burn people out, Camillo. We don't want to underuse them, and we don't want to overutilize them. So we have to be mindful and keep track of that.
Yeah, I agree.
Can we just ask our CTS to
Absolutely.
let us know their time, how much time they can spare for a week, and then based on that, we can assign the patients to them, like the
Yes,
contact.
and if every region head, as you're preparing your volunteer list that goes into our system, if maybe you could send out emails within your group and ask that question, and then we could put that as one of the fields. And then as you're making the assignments, you can see whether that person has put in their hours that they require or less, or can take on more work, or you can do that analysis.
Okay,
yeah,
perfect.
we have that information in a quick survey. I could share that with the regional heads. They could modify that quick survey, and use it again. Yeah.
Wait, what? We have it where?
We have it in the quick survey we did, because for people that started earlier, this is the first 100. We had a quick survey that we sent out to everybody, and we had a 100% completion rate on that quick survey.
Okay, yeah, I haven't seen the results from that. That'd be great.
Yeah, I have the result. Then I have that questionnaire. I could forward it to the regional heads. They could,
you know what, but I think people's circumstances may have changed. I would like to do it from scratch now and ask them individually what kind of time frame they have to offer right now.
And also,
Yes.
the people have a bigger, more clear understanding of what it means to be a contact tracer after taking that course. And they're going to be able to decide, oh, I can only do this, 10 hours a week, or I can only do it 5 hours a week. So they've got more information.
Yes, they could reuse the survey. I'll send that information to them. They could modify that survey. We already have the tool, so they could modify and use it and ask that question again. So yes.
In the CTS manual, the first page is going to list all of the caveats and the critical reminders that are mission critical. So I'm going to have these little things that are put in there in the front, and an index that'll list where they can find stuff. But the most common things that you guys are bringing up right here, I'm going to put that in the front face sheet so that they understand. If you have time issues, contact us here, send an email here. It'll be well spelled out.
Okay, when do you think that manual will be able to be out or reviewed or whatever?
I mean, I'll have a rough copy hopefully by Wednesday.
Okay.
Just thinking about all that's involved with it. If you guys need me to rush that quicker, just make the statement rush. We need it quicker. I'm going to be flying to Miami I'm flying to Miami on Monday. So I'll be there for 2 to 4 weeks, because I need to get there in order to get away from all the stuff that's happening in Atlanta. So like my house and kids going to college. So I'm going to dedicate my complete fuel and energy when I get to Miami on Monday.
All right, and if you need help writing, I'll be happy to help. If you need editing or proofreading, I'll be happy to help.
I need to speak with Leslie, you, and then Camilo, and then John, and then Obi, and then Obi and Dr. Michelle can review what we did. But I think that if Leslie, you, and I get together, we can knock a lot out quickly.
Okay.
So if you guys have time with questions that you've had and Leslie has dictated or scribed down, we can answer a lot of these questions just based on, again, what the protocols are for the Fed and state, which this is the information going to them. And I already spoke to a commander in the HHS on what to do and how to get this information and the avenues. And I have to do one more step to that, and it has to be on Monday. But then I have to review it with Dr. Michelle. So this can go a lot quicker. I think, in my estimation, if we take that sidebar and do that, and answer a lot of questions based on existing protocols and experiences that have already occurred in contact tracing, because that's what the infrastructure is following, is the H1N1 most recently.
Okay, great. All right, so do any of the region heads have any questions or concerns? I know that this is a lot today, but anything from any of you?
Hi, Virginia, this is Janal.
Hi, Janal.
So just to clear what we are supposed to do from our end, we will wait for Dr. Obi's survey analysis, and then we will talk to our CTS and get up the Google sheet together with the email address and the hours that they would fill it in, right?
That'd be great. I mean, I think, and I understand his survey, but I don't know, is it by name, Obi, or is it just the conclusions, the numbers?
No, so well, either one result or share result. I just wanted to share the tool we already have they could use to assess their group. Like there's a template. I don't know if most people feel that there's a quick survey that I mentioned earlier that we could use. We used initially, which we could extend and ask specific questions. They could add more information and send that to the CTS in their region and collect more data. So I'm just sharing a template I've already used. They could develop that more and adapt it to their region.
And do those answers
Right.
get populated into a Google sheet or something? Or do those have to be manually
Yes, it
populated?
gets, yes. No, it gets populated, so you get the response. So I have the response for the first 100 people volunteers, right? I don't have for everyone right now, right? So they will take it from there. They could adapt that template, add more questions, then get the response, and that way they could, summarize the information and share with you.
Okay, so maybe what happens is you send it out to your CTSs in your region and say, if you've already done this, please update it. If you haven't, please complete it. And then we will have a Google sheet or whatever it is that compiles all of it.
Just a question on whatever the survey is, we need to be helped. I remember taking something at the beginning and I think it asked, do you want to work part-time or full-time? I think we need to give them how much, really give them the opportunity to let us know how many hours a week they have for this, whether it be 2 hours.
The question was how many hours? It wasn't part-time or full-time. The question was like 10 hours, 20 hours, or 40 hours or greater than 40 hours.
Oh, yeah. Okay, all right, great.
Yeah, it was that specific.
Okay.
Obi, how about if you send it around and then I'll talk to the region heads and we'll come up with one that everybody agrees on and then it'll get sent out, okay?
Okay, I'll send it to you.
Right.
That sounds good.
Okay. Anything else, Janelle?
And one more thing, there are some people who hasn't responded in 2-3 weeks. How we would deal with that?
I mean, I typically write back and just say, thank you for your interest. Are you still willing to help? Please let us know. And then, I mean, at some point you have to take people off so we don't rely on them and we don't add them to the numbers that inflate it unnecessarily. But I think that sometimes people need to be tapped on the shoulder and told that we need them.
Okay.
Yeah. And we should have a pseudo HR of some sort, like somebody who handles the CTS's concerns, not following, things like that, because we're gonna have quasi quotas and things like that we could check in and see if there's anything. Somebody has to be personnel if somebody wants to volunteer for that, because if we have somebody dedicated to personnel, just personnel, if somebody doesn't want to do CTSing but wants to do personnel, then we could do that and have them maintenance the CTSs since we're in the hundreds, so somebody, because not everyone's going to have a problem. That's why knowing these infrastructure, the experience is that not everybody's going to run into problems. It's always a contingent that it may happen, but the likelihood is it's not, because everybody's kind of smart doing this anyway. So, and the questions will not be difficult to answer, but we should have a personnel department that can handle that or check in on them and well-being, mental health, and everything like that.
And the regional heads aren't the ones to do that?
I think that if we have a department that just specializes in that, the regional heads can get the information and pass it to the personnel department.
But who's that, Dr. Michelle? Who's our personnel department?
Well, we have to put out that somebody has to step up. I mean, somebody should step up, that they want to focus on that and not, there may be people on the fence.
Well, if you look at the org chart that developed, Virginia, that was supposed to be you. So, yeah.
And I don't mind doing what I'm doing, but I'm coming at it from a very logical standpoint. I'm not coming at it from employment. I'm not coming at it from HR. I'm coming at it just as a logical organizer.
I think we should leave Virginia doing what she's doing. She's doing a stellar job. Let's give the personnel to somebody else. It's like throwing it on Camilo or John or Dr.
Okay, are we anything else that's outstanding that we need to
The one more thing, sorry, the point that I really want to make, and I don't know how best to do this, and you guys, Obi, Sean, Dr. Michelle. In normal volunteer situations, we don't have professionally trained people. In this atmosphere, we have a lot of healthcare providers who know a lot. And we need to stress that our CTSs are not healthcare providers, that they are strictly gathering information. And I think it's an instinct that is commendable by doctors to want to give healthcare advice. How best do we, the region heads, the supervisors, rein that in and help them to not instinctively do what they want to instinctively do?
That's Sean right there. That's Sean. Sean, that's the manual. That's the manual. Yeah.
Yeah. Let me have the floor on this. Poison centers, 56 of them in the country, staffed by thousands of physicians, nurses, and pharmacists. Everybody, most of the pharmacists, the PharmDs, and the RNs are board certified. Most physicians will either get board certified in the poison center by CSPI, right? It's the certification nationally. So what that means is that we are all have these certifications, but we are all in a very strict policy that we are not the provider. I know how to do that. I know how to put that in wording that is very succinct for all disciplines, and I'll take care of that, because that's part of what I've been doing for 20 years is working under that thing. We were working under the license of our medical director, but that means the RNs were, the PharmDs were, and the MDs were. And we were all doing the same thing because we had the same board certification when it came to the poison center world and health department. So I have that all figured out. I have that all. I'm just biting off of them because it's a concept that already exists. So I'll take care of that in the manual. I'll take care of that with Camilo. I'll run everything by Dr. Jack, but I will put that in there so it's in fine. Everybody's going to understand that you are not to practice medicine. You know what I'm saying? To boil it down like that, and that it's a dischargeable offense if you do. You know, so there's a pressure to that. But anybody who has those distinctions or education that has those graduate degrees, they're already going to know that, so they're not going to be offended by it. You know what I'm saying? They also know the call to service is a public health call to service. So they know their confines and they'll practice within that. So that's how that will go. It'll be easy.
Okay, absolutely. So as I see it, we're going to be having a CTS training with regard to the app, and then we're going to have a separate training with regard to the substance of what you're presenting in the manual. Those are two separate trainings?
That's correct. And the first thing they're going to learn is that concept, and they'll be fine with it.
Yeah, and that concept is easier said than done, because I've been in a situation like that while I was, working as a consultant, right? There's that there's that tendency, because you want to, but really it with training and, like Sean said, coaching and the manual, most people will be fine. From my experience, most people will be fine.
Yeah, and those who aren't fine, they won't do it.
Okay, so Obi, you're going to find us 30 supervisors, right?
Yeah, we could get that number. Yes.
Okay.
Very good.
And Obi, I can double as a supervisor if you need me to.
Yeah, we'll work together on that, Sean.
We need those like yesterday.
Yeah, I already sent some of the responsibilities to Sean, and I think he's coming up with some information. And Dr. John has already helped us draft some responsibilities for the CTs, and equally we have to put in some for the supervisors and the rest. So we'll work on it this weekend. We should be ready by Monday with some information.
Okay, and then I just want to say something here too again. There's two things that I added on my presentation that foresee two giant problems, and that is transportation. So planes, trains, buses, ships, and not restaurants. Those are different, but anything that has to do with traveling, I made a specific notation to it, because everything else is kind of easy from my standpoint. The things where it's going to get complicated is anything that's transportation, because that automatically we should gather the information, and I'll contact the authorities, and whether it's through the Poison Center in Miami with Dr. Bernstein, however it's done, because they already have the built-in connection, that'll be our quickest route to get that information disseminated and do our due diligence by giving it to them. and they will take care of that, and then we'll have a messaging system that has to deal with those cases. But those are two very big problems, or time consuming, and may stress out the CTS. So what we're going to do is alleviate that. So when you look at the document, just remember those two things are there to specifically state a problem that we're not going to totally take care of. We're going to defer it to me, and I'm going to pass it along to the authorities, and then that will be taken care of. And then we'll fix it in our numbers on how we go about that. But those two problems right there are going to be huge. The second somebody says, I was on a plane from Jakarta to here, it's going to be complicated, but this will alleviate the complication of that. So
Right.
just when you look at that document, just remember that.
Super. Glad we have you there to keep us aware of those things.
One more question, John.
Yeah.
And I know it was raised, but I don't think the answer was given. So I'd like input on when the regions heads are reaching out to their CTSs and they notice that they haven't talked to anybody in a while. What is this? What do we do? How long do we wait? What's the suggestion?
I'll take care of that.
What?
That'll be in the manual. What we're going to do is that I have to look up the specific. I got to talk to the commander again. I got to ask him what the specific time frame is where we have to cut bait. You know.
Okay, got it.
That answer.
And then we give the authority
Again,
to the region heads to delete names or put them on a hold.
When in doubt, defer to me.
Yeah,
Okay.
again, these manuals are very expensive from my experience, right? And and Dr. Sean, we're looking forward to it. Yeah, I've seen. Yeah, they're very expensive on instructions and what to do and disclaimers. Yeah, yeah.
Okay. Well, I hope the manual
Foreign
is
medical graduates have a way of making things cheap, so I'll make sure it's cost effective.
great.
All right.
Virginia, I need to speak with you and Leslie. If you can email a good time where we could talk. It's only a 5-10 minute conversation, but I just want to lay out it'll help organize what I'm about to do. So.
Wait, Virginia, who else?
And Leslie, since Leslie's taking,
okay.
Ms. Walker's taking the notes.
Okay, no problem. No, I thought I heard my name, but okay, if you need me, I'm here.
Yeah.
And if we just stay on this call?
Yeah, you guys can stay on this call.
Yeah, you can. Yeah, and anybody who wants to listen, that's fine too, but I just wanted to keep the focus and set the pace for what I'm about to do, so.
Okay, I'm going to do some other stuff, so if you need me, just text me. If you need me to come back, I'm going to leave you on.
Yeah.
Okay.
Dr.
And
Jackson's
Sean,
gonna be run by you in
Sean,
totality, so
Mary's been helping Leslie with the written instructions.
that's fine.
Is
Ms.
that
Johnson,
part?
that'll be great.
Okay.
Yeah, that'll be great.
Yeah, before I leave the call, because I have a few other things I have to go do. I just wanted to ask, how do we handle some partnership? You know, the members sending emails, people are doing things in Chicago, the other place. How do we match? So I kept receiving those emails. I don't know what to do with them. And I think this is definitely Dr. Michel's question, and you know, anybody can jump in. How do we address, how do we coordinate and work with other people? Forward it to you. Okay, cool.
Yeah. Send them all to me and I'll weed them out.
Okay.
Okay, thank you.
Okay, thank you.
Thank you.
Thank you, guys. Have a good afternoon.
Have a good day. Stay safe, everyone.
Yeah. Bye.
Bye.
Hi, Virginia, this is Geetika. I just have one question. Can you please check the chat box?
Go ahead.
I just put it in the chat box.
Oh, I see it. So I think we're getting the CTS information in the region from everybody who wants to be a CTS. So everyone who's signed up and still interested. And then you have to follow up to say, here's the training, you need the certificate, and then they do it. But I don't think we're just going to, we want to engage everybody, even if they haven't gotten their certificate, and encourage them to get it, and telling them that they won't be able to get patients until they get that certification. So I wouldn't just dismiss them because they don't have it yet. They may not have had time or.
Okay. Yes. Thank you.
So I have a question, Virginia. So after this meeting, what would be our instructions or message to the team for now? Is it just to fill out their names and email IDs? That's it, or is there anything we need to pass on?
No, I think that it's getting the information. I'm hoping that Obi will send me that. And if that survey that he did, we can adapt it to what we need for the regions. And then that information will get populated into Google Docs, that may save a big step. Otherwise, my understanding is we're going to collect the information so that we have the CTS info on hand readily, and then we're going to go through the trial this week of the tracing. That's going to take, I think, the rest of the week. And then as we finish this, and then the manual training for the CTSs. So our guess is hopefully this time, or maybe the beginning of the following week, is when this thing will go live. So it's just a matter of keeping everybody in that knowledge loop.
Okay, sounds good. Thank you.
Right, Sean, do you agree with that?
Yes,
Camillo?
I do. I think Camilla's busy.
Okay, I can understand that. Okay, so what do you need, Sean?
Okay, so what I'd like to do is just a debrief of what we just went over. So Leslie and Virginia, you weigh in based on what you got there and anything, and Mary. But the most important, the most stressed thing that you could see that we went over, Leslie, Virginia, what do you think is like the most important to address right away? So when I'm making the manual, I'm going to do the manual, but I want to get, I want a little bit more focus on what the most commons is from what you see. Because, your review of the didactics is really good. And it points out a lot of valid points that are not in the front frame of mind. I don't know. Are you a clinician, or what's your background? A lawyer?
I'm a lawyer.
Okay. So yeah. So I mean, even better, because all these manuals that we've done before in the past, it was always a legal department. We just never saw them. But they would come back with these, questions. And it's really important, as you know, because it's where we're going to get step in the bear trap. So if you see where all the bear traps are, then that's how we eliminate them, because of your training and stuff, in the legal mind.
I know, but I guess I'm trying to understand, because obviously we just went through so much that I'm not sure what your question is, and I'm not sure everything's going to have to be in the manual. It sounds to me like Leslie and Mary are preparing, and you guys tell me, hold on one second, that they're preparing like instructions for the CTSs when they make the contact tracing phone calls, and also how to use the app. Is that right, ladies?
Leslie?
Leslie?
You're on mute.
Mary?
You're on mute.
I'll chime in if Leslie's not available, but my understanding is there are some Google Docs that Camilo has been helping to prepare. John sent them my way, and there's one doc for instructions for the CTS side and one doc for instructions on the patient side. I'm not sure if this is just for folks who have agreed to help test the app, or if this is going to ultimately become the instructions that we send to the CTS volunteers. And then as far as the patient one, I think the app itself should be explanatory enough that we don't need to send them an additional document, but I can send you guys that if you'd like to look over it. And then
yeah, and I'd like to organize it.
Okay, so Sean, it sounds to me like there's two components to all this. There's form and there's substance. The form being the actual using of the app and the questions that the CTS people ask and all that. That's form. And then the substance is the stuff that you're talking about.
Right.
Am I correct?
That's 100%. Yeah, that's exactly
okay, so if Mary and Leslie work on the form with John, and you work on the substance of from the health perspective.
That would help me tremendously, because I'm going to put all of that together into the manual. You know what I'm saying? Because they have to be incorporated. There's no way not to incorporate, or it would be dangerous to not incorporate them, because it'll just cause confusion. So this thing has to be as quick of a synopsis, as robust as it can be. And again, I've done it before. So, and the poison center is even harder, because there's a million substances, a million drugs, a million concepts, a million public health crises. So there's a way to do it. I'm just going to follow the one that I've already done, because it's already been discussed with doctors of education, PhDs, lawyers, they already reviewed all that stuff before we got it, so, or disseminated it, and the manual is going to work, because the CTS we want to make it as easy for them and also as straightforward as possible. A plus B equals C, and go from there, because we're just got to get this thing off the ground, but in a way that is less, that's going to be most It's got to go flow easy, but there's a way to do it quickly.
Yep.
It's got to be efficient, and there's a way
I'm
to
gonna
do it
ask John to
quickly,
get
but
back on. I'm gonna ask John to come back on and see if we can make this division of responsibility. And it seems like this is a clear way to divide it, and then who's doing what will be fine, right?
And then if Camilo gets the manual, Camilo can answer a lot of questions while he's going through it.
Right.
You know, that's why I feel like I want to be behind Camilo. Every time he pops up with a question, I could just answer it. You know what I'm saying? Instead of having to communicate with me and stuff like that. However it works, it doesn't matter. But
well, and clearly, and my questions on the app are all form questions. I don't know about the substance, but I'm looking at how do we communicate clearly, and is this question open to ambiguity, and are we covering all the possibilities?
Right.
You know.
Yeah.
Okay. Well, if we can divide it up that way, how do you feel about that, Mary and Leslie? Does that make sense to you? That with regard to the form of how people do everything, the steps, the instructions 1, 2, 3, 4, 5, that if we look at the how to do the app, and then the question, and then the from a CTS standpoint, I mean, we don't have to tell the patients anything except this is really for us.
Yeah, we don't want the patients doing anything but answering our questions.
Right.
Because we're data collecting.
Right.
For a purpose. This is why it's not that difficult. It's just
right, Mary,
getting
what do you think?
Difficult.
Agree completely. I reached out because I feel pretty confident in my ability to organize steps. So I would be happy to help on the form end if other people wanted to identify the specific substance of it.
Love it.
And Leslie, I acknowledge that. You really are, you sound like you have this very analytical mind that does that. So I'm really pleased that you're doing this,
That was Mary. I don't know where Leslie is.
Mary, sorry, Mary.
Thank you. I would say the same for Leslie based on the questions that she asked during this call.
I agree. So I think we have 2 people, and with John, the 3 of them will get that finalized. Sean, you're going to do the substance stuff, and I hope you're going to keep it short and sweet, right, Sean? This isn't going to be like a 20-page manual. There should be a couple of pages. That's okay.
I want my how old is she now? 17-year-old daughter to be able to do this. You know what I'm saying? So
perfect.
And then everyone else could just figure it out because they're smart.
Right. Okay. Anything else?
All right. Yeah. Just can I get an email of like people's phone numbers and contacts, because I don't have that.
Guess where that is,
or I
Sean?
guess I do. Where?
It's on the Google Docs I sent you.
Okay.
Everybody's contact information.
All right, and I'll be in Miami on Monday if anybody needs anything.
Okay. Yeah, I'd invite you to dinner, but I can't.
There's nowhere to go.
In practice, and primary care doctors, so you can come over to my house. We're all clean. Well, in my Miami house, but my mom's a neonatal pediatric cardiologist, and my stepfather's an internist and a pediatrician.
And where do they live? What part?
My mom's at is part of the Miami Heart. She's one of the directors at Miami Heart. No, at Miami Children's or Arnold Palmer.
Okay.
And then my stepfather, my uncle, my aunts and cousins, everybody, they're all part of a Humana practice in Miami. They were the first ones to take HMOs in Miami, so it's a big organization.
Oh wow! So they live down in Kendall?
They live in Coral Gables in the Sojourn building, that giant tower that's across from Granada Golf Course.
Oh yeah, I know it well.
Bush building. Yeah. So they're on the 3rd floor. So that's where I'll be. Too bad John Martin's is closed. That's what I heard.
It just did. It just did.
Yeah, my mom went to Lourdes. She's from Miami.
Oh wow.
But
all right.
New York.
All right, let's let everybody go. It's been 2 hours.
Thank you, Mary.
Okay, thanks everybody.
Talk to you soon.
Hey, everybody.
Bye.
Bye-bye.
Okay. Bye, Camilo.
Thanks, Camilo.
Bye, guys.